Welcome everybody. I am going to switch over to share my screen so you can see my lovely PowerPoint presentation, and we have more to be presented as well. Let's go on present mode. So thank you for joining us. It's been a while since we've been here together, and I'm excited that this will be almost our last installment for the P-Core, and I will let you know that the Near West Side Partner weekly webinars are going to be put on hold for a little bit. We're out in the community and want to spend our time outdoors with you, and we'll put these back on the radar most likely in the winter, especially if our COVID continues on the rate it is again. So I will move on in to remind you what patient-centered outcome research for employees for the Near West Side is. It is a research project, and it is through two professors at the Marquette University, Dr. Abiola Keller, Dr. Dan Pinto, and they're really looking at trying to help employers involve employees in decision-making regarding health and wellness. So in the part of this, we do invite guests to come in and help learn more about what's going on in the community, about being healthy and well, and especially during the COVID crisis. Some reminders of what's going on here in the Near West Side. The Valete Street Oasis is just crack-a-lackin'. Do be sure to get by there. It's between 3 and 6 on Fridays, Saturdays, and Sundays. We are chock full of vendors, a different one on Friday, Saturday, Sunday. We just added a new one for Saturdays. You'll find some other goodies. And then, of course, there's our two vendors that Restaurant Triciclo Peru and Pete's Pops. So you can always make sure you get something cool to eat or drink and enjoy that market. So take time to stop in by. Next, do not forget the Hunger Task Force Mobile Market is open to all in the community. And the next time it is rounding through our specific neighborhood is on Tuesday, August 9th from 1:30 to 3. It has all sorts of great options for produce, dairy, cheese, fresh fruits and veggies. They only accept credit cards, no cash, but debit, credit. And then of course, if you are using the food share program, you can use your EBT card. And a couple other little fun ditties going on here in the Near West Side. The Pabst Mansion has added a beer garden. So if you have not checked that out, do. It's a fun little way to celebrate the Near West Side and the great history that we have in our community. And they also have some other neat little events. I mean, you always can do that beautiful tour. They have a mimosa Sunday, and then you can do an actually beer guided tour. So take some time to celebrate Milwaukee and get down to the Pabst Mansion. Yesterday, we had the soft unveiling of our newest mural, and that is a result of the Choice Neighborhood Initiative grant. And you will see Jenny Gao, who is our artist, and she is there explaining about her artwork. And the title of this installation is Year of the Metal Ox. There's a bit of a backstory to that, but a lot of it goes into the word metal means just really kind of putting your foot to the pedal and resilience. So she really explained a lot of what the symbolism of this artwork meant. And it's one of the best parts of meeting artists as these events occur to really understand what they are doing. And she also has an opportunity for you to share a story about your resilience. Pete has it in the Pete's Pop shop. It's on hard copy. There's no website yet, but if you would like to share a story about resilience, you are welcome to fill this form out. So we are excited to be able to see, this is the first of several installations that you will see in the next few months. And now that COVID is still a crisis here, and we really need our community to get vaccinated. Here in the Near West Side, if you live in 53233 or 53208, you can get a vaccine. And if you prove that you've gotten it, you can get a free dinner from Daddy's. So that's a pretty dang good deal. Most of y'all know how great that dinner is and what wonderful community partners Daddy's owners are. We're very grateful for their willingness to cooperate with this and really help our community stay healthy and well. get that vaccine. If you have questions, talk to your doctor, learn more about it, talk to your family members. This will help keep you healthy and well. And we really want to make sure that folks are on the right path there, which is the perfect segue for our guest speakers today. We are bringing in the Medical College of Wisconsin with Dr. John Moyer and Priscilla Wallace, and they are our principal investigators on a project called Fight COVID MKE. And so they're going to share with us what this project is, why it's beneficial, and then how you can participate if you're interested in being part of this research study and helping generally gain much more knowledge about what's going on with the COVID-19. It's important that we get that research and help understand how to continue to battle it. So I welcome Dr. John Moyer and Priscilla Wallace. And Priscilla, I'll let you take over there. And I'm going to stop share. There you go.
And while Priscilla is bringing up the slides, let me introduce myself.
Please do. Thank you.
Thank you, Barb, so much for the welcome, and grateful to the Near West Side partners for this opportunity to share some information about COVID, about our vaccines and opportunities for protection, and our research project to better understand what puts some people at greater risk of hospitalization while others are relatively protected. I'm the principal investigator of this project with Reza Shakir and Bernie Black at the Medical College of Wisconsin. I'm grateful to the co-PI of the PCOR project, Dan Pinto at Marquette. He and I collaborate in the Clinical Translational Science Institute of Southeast Wisconsin, which includes MCW and Marquette and others on workforce development. And Dan connected us to Near West Side. I'm a professor of community health. I love doing community engaged research. And I'm a pediatrician with Children's Wisconsin and direct our Institute for Health and Equity. So we're really interested in the social justice, the health equity issues to reduce disparities among vulnerable populations with regards to the pandemic. I'm not seeing the slides quite yet. Should I share my screen with them?
Priscilla, do we have you coming up? I have stopped share at this point. Yeah, we should be good, but we'll give it a minute. In the meantime, why don't we?
And I can.
Oh, there she goes. Yep, and we know how to fill in the blanks.
Thank you, Priscilla.
Hey, Priscilla.
Priscilla is the program director. She oversees a team of more than a dozen clinical research coordinators who are working on our project, engaging potential participants. Next slide, please. So just a little background to our research study. Milwaukee County, about 1 million people, 11% of the population have had a positive COVID virus test, PCR being the most common. Many more have been tested, but the Centers for Disease Control thinks that the number that have actually been infected in Milwaukee County is closer to 40%. So there's 30% who haven't been tested when they were infected with the viral testing capability. So we're really interested in getting to the actual number that have been infected, because the greater the prevalence of infection in a community, the greater the risk of contracting it and in turn getting sick and ending up in the hospital. And so the prevalence of infection has a major impact on the risk of hospitalization or even death. Most of the studies that have been done are studies of people in the hospital with COVID. And we instead want to recruit from people who are not in the hospital with a variety of different backgrounds to better understand true risk for ending up in the hospital. So far, our understanding is that the greatest risk for being in the hospital or dying from COVID is older age groups, Native American, Hispanic, and African American adults, people with chronic health conditions like diabetes, heart disease, lung disease, and even housing and food insecurity. And the virus test, that PCR test, measures active infection. I've got that coronavirus in my nose and throat, versus an antibody test can measure past infection, creating antibodies, proteins in response to the infection that linger months later. Vaccination locally in Milwaukee, across our country, and frankly globally, is our best way to control the pandemic. And short of that, it means masking, distancing, virtual interactions. So we're very interested in people understanding risk and protection to make choices that make sense for them, their families, and their community. Next one. So this is a snapshot of the Milwaukee County COVID dashboard. Every day it gets updated with actual information. The Medical College of Wisconsin Institute for Health and Equity epidemiology team provides important analyses for the county. And so you can see a quick summary of key health and safety indicators as of July 22nd, that cases are in the red zone. We've had 14 days of significant positive trends, increases of cases, particularly due to the Delta variant. Test positivity and care, access to healthcare resources are in the green zone. Things are going okay there. But when it comes to vaccinations, we're below 50%, and that puts us in a vulnerable state. Next one. So this is the percent of Milwaukee County residents who have completed the vaccine series, gotten 2 Moderna, 2 Pfizer, 1 Johnson & Johnson vaccine, the FDA approved under emergency authorization. And these are people who are eligible for vaccines, so currently age 12 and up. We hope that younger children might be eligible in November or December based on current studies underway and the FDA and CDC's approvals that are required. So you can see that overall, a little over 46% in Milwaukee County eligible have been vaccinated. While other part of the country, there are places that are 70% or better. So we really need to improve, because immunization prevalence creates herd immunity, which suppresses the coronavirus from spreading. So let's take a little closer look. Among 65 and up, 76% immunized. That's fabulous, because they're at greater risk of severe illness, but only about 30% of adolescents and younger age groups. And if you look even more closely, you'll see 45% people of white background, 36% of Hispanic Latino background, and 26% of people of Black African American background. So there are racial ethnic disparities as well as age disparities. They're an important part of our attention to how do people perceive risk, what's their sense of the risks and benefits of vaccine, what can we do to better influence decisions that people make about the protection available. Next one. So this is a quick summary of vaccines and masks. They work. They reduce COVID disease burden based on a multitude of studies at individual and population levels. So we've seen a drop in cases, hospitalizations, and deaths, most among adults 65 years and up, due to the highest vaccine rates. And this positive trend will continue if people get COVID shots. 96% of physicians across the country are fully vaccinated, not because of mandates, because they judge the benefits to outweigh the risks of the vaccine relative to getting the infection. And 99% of recent COVID deaths and hospitalizations in the US are unvaccinated people. So they're very vulnerable. People who never wore a mask are 2 times more likely to get COVID as people who wore a mask all the time by self-report. And people who wear masks are 3 times more likely to get tested. So when we look at that testing result, the people who've had past infection and not being tested are often the folks who don't wear masks and perhaps not getting immunized. Next one. So why do people choose not to get the vaccine? Well, there's lots of reasons, and they're individual, their family, their social networks. There's a lot of different forces at play and different information people have access to. I kind of like this chart that comes from a historically Black college and university that has a Center for AIDS Health Disparities Research that's responded to the pandemic in doing additional research. And what you can see is you work your way from the bottom of immune naive, folks who don't have immune protection because of past COVID infection or vaccine, working up to herd immunity, where you have the vast majority of people in the community immunized. So there's misinformation and disinformation, a pandemic, an infodemic of information. There's science out there, but many people distrust it or have fear that the vaccine is going to do more harm than good. Conspiracy theories, a lack of awareness of healthymilwaukee.com, which is a fabulous resource, multiple languages about the vaccine and where to get it. The challenges of institutionalized racism and the impact in the Black and Latino communities of research that has not been respectful of people from those communities. People with poor social determinants of health. I mentioned housing and food insecurity are high risk factors regardless of race, ethnicity, and socioeconomic status. And then there are people who are opposed to vaccines. And so 50% of people get flu vaccine every year in Wisconsin, and we're likely to see the same kind of challenges of people who are opposed to COVID protection. There's the politics that we see with regards to the vaccines, and then the challenge that we won't be safe in Wisconsin or the US until we get global protection and access to vaccines widely. And in the meantime, variants like Delta and other are going to emerge, mutations, just like every year we need to get a flu vaccine. Right now there's research about whether or not we need to get boosters of COVID vaccines, currently not required, but people who are immunocompromised. Recently, the CDC Advisory Committee on Immunization Practices recommended if you're immunocompromised to consider a booster vaccine for extra protection. Next slide. So Priscilla is going to tell you a little more about our research project, and we'd be honored to interact with you individually or answer any questions you might have.
So the questions we would like to answer as a result of Fight COVID Milwaukee is one, what percentage of adults in Milwaukee County have ever been infected by COVID? Next, we want to know is how long does the COVID antibodies last and protect people from reinfection? Next, we want to know what factors affect the risk of severe illnesses and death from the COVID infection. And finally, we want to know after the COVID vaccinations, do adults get sick with the new variants? How will we answer these questions? A combination. We're going to be doing surveys asking about information in terms of where you live, are you wearing a mask, those kind of things. And then we're going to look at your antibody blood test. And then we're going to take a look at your medical record information. Please be mindful that we secure the data that we obtain, so no personal information is identified, your name, address, or anything like that. Everything is scrubbed clean, and we're just looking at the health results. Community participants. So Fight COVID Milwaukee is looking for adults ages 18 and older. They must be a Milwaukee County resident and patient at 20 of the primary care health centers or a Medicaid Badger Care member. The 20 primary care health center partners we have on board, our community healthcare centers, Outreach, Progressive, 16th Street, and those through the Medical College of Wisconsin, Ascension, All Saints Family Healthcare Center, Ascension Columbia St. Mary's Family Health Center, Frederick General Internal Medicine, and then those from Frederick Community Physicians include Greenfield Highlands, Lincoln Avenue, McKinley, North Hills, Sargent, Tosa, Calhoun, Drexel Town Square, Good Hope, Glendale, Mequon, Moreland, Sunny Slope, and Town Hall. We have partnered with 10 community and faith-based partners. Our community partners include Northcott Neighborhood House, the Social Development Commission, YMCA of Metropolitan Milwaukee, Journey House, Milwaukee Christian Center, Next Door Foundation, Silver Spring Neighborhood Center, Near West Side Partners, and the faith-based partners include General Baptist State Convention of Wisconsin and Wisconsin Northwest Jurisdiction Church of God in Christ. What are we asking participants to do? One, we want you to review and read our consent form, which usually takes about 10 or 15 minutes. Then we ask you to take the survey, which is an additional 10 or 15 minutes, and then have your blood drawn at one of our sites. And that process takes about 20 minutes. If interested, optional follow-up antibody draw at 4 months is available. Note, after completing your survey and doing the blood draw, we are providing a debit card payment as a thank you for your time. How do you register? Online sign up. We ask participants to go to fightcovidmilwaukee.org. Click on complete the eligibility survey and complete the entire sign up process from the comfort of your home. You can also sign up via telephone by calling our study team at 414-955-2684. A research team member will walk you through the sign up process. The Fight COVID Milwaukee study visits include 2 visits. At your initial visit, we'll review the consent form. We're going to review the survey. We're going to then do the blood draw and then provide you a $35 gift card payment. During your 4-month, if you choose to participate in that, we will also have you do another survey. It will include an additional blood draw, and you'll be provided a $25 payment. For those individuals at the first visit who chooses to answer additional questions, we are providing an additional $5 for those survey questions. So how do you get involved? Join the 1,100 enrollees that are currently participating. Give us a call at 414-955-2684, or you can email us at fcm@mcw.edu, or visit our website at fightcovidmke.org. We're also providing some information on recommended COVID resources such as Fight COVID Milwaukee, COVID-19 MCW, County Milwaukee is providing some, Healthy MKE, one of the ones Dr. Moore mentioned earlier. DHS Wisconsin has information, GetVaccinationAnswers.org, greaterthancovid.org, and Vaccine Equity Cooperative is an additional resource that you can use to get information.
Yay, you did
So
it.
with that.
Awesome. Wow. So I'm going to ask a couple of questions because I always can come up with a couple of good ones. And as you can tell, my colleague and I, Elizabeth, love doing these webinars because we get to meet a lot of people. Oh, here's one right now already. So I'm going to go ahead and ask it. Are there studies like this happening in other parts of the state as well?
Yes, so Fight COVID Milwaukee is part of the Radix Up NIH portfolio. Radix Up are studies of diagnostic approaches to addressing COVID. We're involved in a testing project with more than 60 sites across the country 50 of them are focusing on viral testing. 10 of them are doing antibody testing like us. In addition, some of the Radix Up sites are doing social behavioral research, trying to understand how people make choices about the vaccine and masks and distancing. And others are doing an interventional research, looking at medications to treat COVID and other kinds of interventions. Radix Up is the biggest community engaged research project of its kind that NIH has ever conducted.
Okay.
And the hope is data collected from all the sites will be useful for analyses in future years. Very similar to the All of Us research program that includes the Medical College, UW-Madison, Marshfield Clinic, etc. We had one much smaller Radix Up project at MCW at the Center for AIDS Intervention Research. They did a little bit of behavioral studies among their cohort, but ours is a bigger study that might extend through September of next year.
Interesting. And then the other question was about throughout the USA. So then you've answered that this is a national consortium of researchers trying to get information. Cool. And Elizabeth just came up with another question. Are there other sites, studies in the network looking at youth 12 to 18? What about our young people that are risk just like the rest of us?
Yeah, our Fight COVID Milwaukee study focuses on adults 18 and up for enrollment. Other surveys include questions about children in their household and whether they've had COVID and had health concerns, but we're not enrolling adolescents or children in this study. There are Radix Up sites that include children outside of Wisconsin.
Okay. And I'm going to segue off that question with the youth right now too. Obviously, from the data you presented earlier, many of our youth are not vaccinated. Is there a thought as to why that's occurring and how that can be modified or what we can do to help get families to get their youth vaccinated?
Yeah, so youth vaccination is an opportunity for age 12 and up. The same processes, decisions that I shared earlier are relevant because an adolescent needs a parent's consent for the vaccine, and then the teenager's assent to get the vaccine. So if parents aren't getting the vaccine themselves, they may not choose to do so for their kids. And that's why we see a 50% influenza vaccine protection rate for that condition that is a threat. It's a top 10 killer in the US preceding our pandemic. There are back to school campaigns, City of Milwaukee Health Department, social service agencies that are working to include immunization opportunities for the back to school events that are happening in August. Schools are making decisions about children wearing masks, whether or not they've been immunized, and tough choices about remote education versus classroom if concerns about the surge of Delta continue into the fall.
You bet. And then you also mentioned that booster vaccine and also immunocompromised. Can you tell us a little more about just being immunocompromised, what that means, and then where somebody with that type of illness might get a booster vaccine?
Sure. So the COVID vaccine, 2 of the shots, Pfizer or Moderna, is full vaccination, or one of the Johnson & Johnson. And the evidence to date is that those vaccines substantially reduce the risk of hospitalization or death from COVID compared to not being vaccinated, even if people have had a past infection and have some antibodies. They provide added benefit and value. There have been some breakthrough infections, people getting the Delta variant in particular, which is more infectious and spreads faster, even for people who've been immunized, but currently no recommendation for a booster vaccine yet. However, the Centers for Disease Control has an advisory committee on immunization practices And last week they had a national conference where they were reflecting on the science to date and the evidence that people with immune problems, folks who have had cancer, sickle cell disease, other immune conditions might be at greater risk for getting COVID and other infections and might benefit from getting an extra vaccine. It's really up to that individual to talk with their doctor, a doctor who has expertise in primary care, infectious disease, immunity, cancer, whatever the condition might be, to decide what's best for them. We know at Freighter over 4,000 people have had antibody tests, but the vast majority of people aren't getting antibody tests like we offer for research purposes because it's not a standard part of clinical practice yet. But that's one way to know if the vaccine worked, creating antibodies to the vaccine. We've had a few people, mostly people with immune issues, who have not created antibody in response to the vaccine. So that's also something to talk with a doctor about. Can you get an antibody test? Of course, people who enroll in our research study will get an antibody test. Did they respond to the vaccine? If they didn't get the vaccine, or if they did they have evidence of a past infection? Because we expect a number of people are going to be positive for the capsid test, past infection, and not even know it. They might have had what they thought was a cold or a sore throat, a lot of asymptomatic infections, particularly among younger people.
Yeah, interesting. And then we did get another new question. We've got interested folks. How will the study findings be made available to the public, and what information might be coming out as soon as you know it, real-time findings?
Yeah, so you can go to our website, fightcovidmilwaukee.org right now, and we have a page of our study design, our preliminary findings. Priscilla and I were on Fox News a month or two ago to share what we're up to. We're going to be updating the information on our website based on our analyses of 1,300 surveys, and hope to have that information in 2 or 3 weeks. We're beginning to link the data and hope to have preliminary results from that in a few months. So we're every few months doing releases and updates of what were preliminary findings from our study. And also you can find an individual risk estimator and a group comparison estimator that's based on our analyses of death records from Medicare across the country and deaths occurring in Milwaukee, Cook County, and Indiana. So that risk tool also might be interesting for people to look at. If I'm immunized or not, how does my risk from COVID compare to things like dying from a car crash or from a heart attack or from the flu or pneumonia?
Interesting.
All at our website.
Wow. Well, we'll pop that back up before we finish. And then how many enrollees are you looking for? What's the number you're trying to target here?
Yeah, we're hoping to, right now we've got about 1,400 enrollees. We'd love to have several thousand.
Okay.
Each enrollee who's been vaccinated might have a couple antibody tests. And as Priscilla mentioned, the option to come back 4 months later and see if that antibody is still persisting, or if there's evidence that an infection occurred in the interim. You know, that's part of our answering those research questions that she presented initially.
Yeah, very cool. So I think one of my takeaways is if anyone has not been vaccinated and had any type of symptoms and didn't get tested, they'd be a great candidate for this to see if maybe they did have that non-symptomatic COVID and or just a very, very, very mild case. So
yep,
this is one way for them to help.
Yeah, we'd love people vaccinated
great.
or not, past COVID infection or not, young or old, Black, white, Latino. We would love variety because that helps us to take a small sample of participants and then use statistical ways to extrapolate or estimate for a much bigger population.
Yeah, very cool. I love this stuff, as you can tell. So I probably will be heading to the website shortly after we're done with this call. And I'm already into all of us study. So I enjoyed getting
Awesome.
that information and just learning more. I got a little bit about my genetic heritage and just trying to help us all be healthier at the end of the day. And it really takes that research to get us there.
Barb, I'm going to share the screen.
Please do.
If people are interested in finding out or wanted to contact Dr. Moyer or myself, that includes our email address. So feel free to give us, send us an email if you have any additional questions regarding the research project, and we'll definitely be in touch and answer as many questions as we possibly can.
Oh, for sure. And then your website is fightcovidmke.edu?
Org.
You never know. So pretty simple to find, but Fight COVID MKE, if you Google that, you will find the right place to go.
Absolutely.
And for sure. And again, I can't emphasize enough for our general community, get yourself vaccinated. We're at a point where you can get something good out of the deal too. And that's even better. So I just sacrificed me and my arm when I went when I could, but I'm glad I did. You know, wear that mask and wash those hands too, peeps.
Correct.
Yeah, when you get in that grocery store and come out, just it's really going to make a difference in our overall health, not to just you, your community. So because we don't always know when we're sick. So awesome. I'm going to just do exit full screen here. I'll go to my share screen and bring us back to my slides quick and make sure I get through what I need to do. And I'm hitting where's my button? Oh, you know, things move on your screen when you do this, right? Okay. Escape. Elizabeth knows I go through these little woes trying to
I could share the screen with our information if you would like.
There we go. I think I have it. It should be good, but I don't. There we go. So as far as P-Core goes, please let us know if you have any questions, suggestions, thoughts on some of these webinars. We want to learn more. Again, we can be another resource if you don't remember how to get to the Fight COVID MKE. And then if you have questions about being involved with the P-Core project, we need employees on board and welcome all businesses in the Near West Side to be part of this project. So we appreciate it. And then why don't you go ahead, Priscilla, and put up your information one more time so we can close with that. And we'll give it a little bit of time and then I can do and we'll be done. So we just want to make sure that you all get that information out. And I was going to say, while we're just looking at that, it sounds like you're have the ability to really help people walk through this, understand what's going to happen, why it's happening, what the different pieces are, like antibodies. So and phone calls are free, right?
Mm-hmm. They are absolutely free. Just like we're trying to find out how COVID has impacted our communities, we're also want to educate our community in terms of COVID. So yeah, we're very hands-on.
Awesome. Well, thank you too again for your time and contributing to science and helping keep our community and world healthy. I appreciate it.
Thank you much for having us.
All right.
Yep. Thank you, Barb.
Afternoon.
Take care.
Bye-bye.
So long.